Alice with the ARC of Grays Harbor here today for a COVID Q&A with Anna Garcia from the Health Department. Hi, Anna. Nice to see you.
Hi, everyone. My name is Anna Garcia. I'm a community health specialist with Grays Harbor County Public Health. I've been with Public Health since December 2018, and I'm currently the test and vaccine coordinator for the COVID-19 response team, as well as the emergency response coordinator. Before we can get started, I just wanted to remind everyone that I'm not a healthcare provider nor a nurse. All of the information that I will be sharing today, it can be found on the Washington State Department of Health website at doh.wa.gov or on our website at healthygh.org.
Well, thanks so much. Thank you so much for being here. So we're going to start first talking about COVID testing. So I think a question a lot of people have is when should they take a COVID test? Like if they're having certain symptoms, if they're going somewhere particular, when's a good time to take a COVID test?
There are different reasons why one person should get tested. One, you should get tested when you feel sick. If you're experiencing COVID-related symptoms such as fever, chills, cough, shortness of breath, fatigue, muscle or body ache, headache, new loss of taste or smell, sore throat or congestion or runny nose, nausea, vomiting, diarrhea, or you just don't feel good, you should get tested. It's also a good idea to get tested when you're going to gather up with a group of people, especially with those who are at risk of severe disease or may not be up to date with their COVID-19 vaccines.
And where can people get a COVID test in Grays Harbor? What's the best way to access testing?
There are several sites in Grays Harbor County where people can get tested. We have a curated site right outside our office, located in the parking lot of the Public Health Department. There's also, you can also go to Health Mart Pharmacy in Elma and McCleary. There's also the Rite Aid in Hoquiam. We also have Discovery Health in Ocean Shores. People can also access COVID rapid tests by checking their local Timberland regional libraries in the Grays Harbor Transit Centers. You can also submit monthly orders of rapid test kits online at sayyescovidhometest.org.
Mm-hmm. Perfect. And I will put that link in the description of the YouTube video. So check below if you're looking for that link. What should people do if they do access those at-home rapid COVID tests and it's a positive test result?
Okay, to report a positive at-home COVID test result in Access Care Services, please call the Washington State COVID hotline.
Another thing we wanted to chat about was the vaccine. So we just had a couple of questions, and I think these are questions that people ask us, and so they're kind of out in the community. People wonder if the vaccine is safe and if it's effective.
Yes, there are 3 COVID vaccines that are authorized for emergency use and fully approved by the U.S. Food and Drug Administration, also known as the FDA. These vaccines were shown to be safe and effective in clinical trials. They were developed, tested, and authorized using the same rigorous process used for other successful vaccines. However, the FDA has limited the authorized use of the Johnson COVID-19 vaccine to individuals 18 years of age and older for whom other authorized or approved COVID-19 vaccines are not accessible or clinically appropriate, and to individuals 18 years of age and older who elect to receive the Johnson COVID-19 vaccine because otherwise they wouldn't get that vaccine.
If somebody hasn't been vaccinated yet, is it still worthwhile to get vaccinated?
Yes, it's still worthwhile get vaccinated. COVID-19 vaccination significantly lowers your risk of severe illness, hospitalizations, and death if you get infected. Compared to people who are up to date with their COVID-19 vaccine, unvaccinated people are more likely to get COVID-19, much more likely to be hospitalized with COVID-19, and much more likely to die from COVID-19.
And what if somebody already had COVID? Does that give them protection, or should they still think about getting vaccinated?
You should get a COVID-19 vaccine even if you already had COVID-19. Getting a COVID-19 vaccine after you recover from COVID-19 infection provides added protection against COVID-19. People who already had COVID-19 and do not get vaccinated after their recovery are more likely to get COVID-19 again than those who get vaccinated after their recovery.
And if somebody has been vaccinated, should they get a booster?
Yes, booster doses will help provide continued protection against severe diseases. This is especially important with the rise of more contagious variants and cases of COVID-19 increasing across the United States.
Yeah, very important. What booster should people get? Do they have a choice, or what's the latest on that?
You can get a different vaccine for your booster dose than the vaccine you got for your primary series. The CDC made their decision following a careful review of the latest data. The only restriction is for people 17 and younger. They're only able to get Pfizer vaccine for their booster dose.
Okay. If somebody's immunocompromised, should they get a fourth vaccine dose? And if so, when?
For individuals whose initial COVID-19 vaccine series was an mRNA, Pfizer or Moderna vaccine, a 4-dose booster dose is now recommended to be given at least 4 months after the third dose. So 4 months after the third dose, it is recommended. A second booster dose for Pfizer COVID-19 vaccine may be administered to individuals 12 years of age and older with certain kinds of immunocompromise at least 4 months after receiving a first booster dose of any authorized or approved COVID-19 vaccine.
Okay.
If people got the J&J vaccine, they're more with moderately to severely immunocompromised, they should get a single COVID-19 booster vaccine at least 2 months after their initial J&J primary dose. Adults who receive a primary vaccine and booster dose of J&J COVID-19 vaccine should get their third booster or their second booster 4 months after the last one.
Okay, perfect.
And it should be either Pfizer or Moderna.
Okay. So they want to switch from the J&J to the Pfizer or Moderna for those boosters.
If they got their first and second vaccine from J&J, then the third one will be a second booster, but with Pfizer or Moderna.
So now that we've covered that, I wanted to chat about masks a little bit. Is that a good, effective line of defense against COVID?
Yes, wearing masks remain an important tool for reducing the transmission of COVID-19, especially with the emergence of more contagious variants. Masks continue to be required in some settings, including healthcare settings, long-term care, and correctional facilities, some local health jurisdictions, some schools, and even some businesses may still require us to wear a mask. And it's still very effective and important to do so, especially if you're not feeling very well. Right.
So that brings me to when somebody should wear a mask. I know you kind of talked about that a little bit, but can you elaborate a little more on when a mask should be worn?
You may choose to wear a mask at any time. People with symptoms, a positive test, or exposure to someone with COVID-19 should also wear a mask to protect others. If you're immunocompromised or at high risk for severe illness, then that puts you at high risk and you should be wearing a mask. It's very recommended.
Okay. Is there a certain type of masks that are more effective or that people should be wearing?
There are multiple types of masks: surgical masks, N95s, KN95s, cloth masks. Wear a mask with the best fit for you, protection and comfort. It is important to remember that any mask is better than no mask.
Is there somewhere that people can get masks in Grays Harbor?
Yes. So the Rite Aid in Aberdeen in Holcomb, we're giving out masks for free. You can also call the 1-800 number 232-0233 that we can also include in the description box, where you can find other nearby places where you can get free masks.
Okay, wonderful. That's a great resource. So if someone has tested positive for COVID, we want to talk about or ask about what should they do? If they've tested positive, should they quarantine at home? And if so, for how long?
People who have a positive test for COVID, regardless of whether or not they have symptoms, should isolate at home.
Okay.
People with symptoms of COVID-19, including people who are awaiting test results or have not been tested, should isolate. If you have COVID-19 and had symptoms, isolate for at least 5 days. To calculate those 5 days, it's the period, like the day 0 is your first day of symptoms.
Okay.
If you don't have any symptoms, then the day that you got tested is your day 0, and then it goes from there.
Okay. All right. And what symptoms should somebody be looking out for?
Like I previously mentioned, like runny nose, cough, fever, chills, nausea, etc.
Okay.
After those 5 days, full 5 days, you may go out of isolation. However, we do recommend to continue to wear your mask, especially when around others, indoors or outdoors, for an additional 5 days.
Okay. If somebody is feeling pretty sick, when should they call the doctor?
Just call your medical provider for any symptoms that are severe, concerning for you.
Okay, what precautions should you take so you don't get other people sick?
Stay home. Stay home and away from others if you're feeling sick. Wear a mask. Wash your hands often with soap and water for at least 20 seconds. Clean and disinfect objects and surfaces around your house and as often as you can. And stay 6 feet away from others.
Okay, are there any medications that could help somebody get better from COVID-19?
There are currently 2 types of treatment: an antiviral treatment and monoclonal antibodies.
Okay.
Contact your healthcare provider for more information on this. You may qualify for one of these COVID-19 treatments depending on your age, health history, and how long you have had symptoms.